welcome, Dr. Jimmy Nanda, and we are extremely grateful to have you on board with us. So, Dr. Jimmy Nanda's one thing I'm going to say before he introduces himself. He is someone extremely impactful, someone who is creating things, someone who is trying to break boundaries, someone who is reaching heights, someone who has climbed the Mount Everest. And I look up to him. Like, I recently met him and I am like in awe. So I would like if Dr. Jimmy Nanda introduces himself so that it is something raw and it comes out from his words. Yeah, you can go ahead, sir.
Well, first of all, I'm humbled and honored to be with you, Dr. Rashi. It's a pleasure. And I look forward to learning a lot about what's happening with your magazine, and congratulations on that. And yes, my name is Dr. Jimmy Nanda. I'm Indo-Canadian. My parents immigrated from India in the 70s to Canada. And since then, we've been deep-rooted to our country, India, as well as Canada. And I've had the opportunity over the years, as I was going through school, to come visit family and be connected. So when I had the opportunity to become a doctor during school, I was in my chiropractic phase of college. There was a wedding that I came to in India, and I realized at a family wedding that there was no chiropractic in India. I was shocked and blown away because it was all over the world in all industrialized countries. So at that time, I started out and ventured out to start the first official association for India, representing India, called the Indian Association of Chiropractic Doctors. Then when I graduated as a doctor in 2003, we opened our very first clinic in India in the Delhi area. And it's been a journey since.
Physiotherapy is based on movement science. So on those grounds, what do you think is the science behind chiropractic, and in what all specific conditions is chiropractic indicated? Will you share?
So, absolutely. So that's a fantastic question. Just like you say movement science for physiotherapy, even orthopedic surgeons or kinesiologists are doing movement science.
Yeah.
The biggest difference is how we treat or how we look at the condition. So chiropractors traditionally look at and assess nerve, muscle, bone, joint, and tissue conditions. So it's a full realm of conditions, and chiropractic education includes very advanced training in radiology, whether it's x-rays, MRI, CT scans. So we look at all that, blood reports. So in North America and many countries that have chiropractic as part of the healthcare chain, they're primary physicians. So they look at the full assessment of the body, come up with a treatment plan. Now, traditionally, it is the specific chiropractic adjustment that we do, or on the spine, wherever we find any abnormalities or any issues or nerve issues, neurological issues. That is where we differ than an orthopedic surgeon, which will go in intervention with surgery, or a physiotherapy may use modalities or do rehabilitation of the muscles. So our niche is the chiropractic adjustment, but our knowledge base is the same as an orthopedic surgeon or even a physiotherapist in muscle movement and muscle rehabilitation. We are trained in all of that. So I would say that if you were to define what our specific indications are, it's anything to do with the nervous system, joints, spine, and that's what our focus is on. And just recently, just so you know, chiropractors here, we have a big lead now focusing on concussions. There's a lot of sports teams all over the world now that have a chiropractor on the team, so sports injuries. And we also deal with a lot of geriatric patients, as well as a lot of rehabilitation. So it's one of the focuses, but most importantly, recently in North America is the opioid crisis. We've been having, as you know, an opioid crisis going on here with addiction. And now chiropractors have been in the forefront now to come help with the opioid crisis, dealing with and managing pain, so that patients are not looking at opioids as a first treatment.
Wow, that's amazing, sir. That's something really different from physiotherapy perspective. Are there any specific different subjects that you learn in chiropractic that are not covered in physiotherapy syllabus as such?
Sure. So I would say that the physiotherapy syllabus and even the orthopedic medical syllabus Our syllabus is the same as essentially medicine, okay? In India, I can say, I've looked at some of your school's curriculums for physio. You're also learning the same as MBBS and surgeons. You're learning the same. Where we differ is in the internship part when you're doing patient treatments. You go into rehabilitation, an orthopedic surgeon would go into surgery, MBBS would prescribe medication. Same thing with chiropractors. We would learn, and we're experts in spinal condition diagnosis. As I said, anything neurologically related. And we're able to do specific spinal adjustments, or some chiropractors get into very high technology type treatments to treat spinal conditions. So we differ on the treatment protocol. And very more importantly, just so you know, Dr. Janvi, that there's a philosophy behind this all, okay?
No.
So philosophically, chiropractic's roots are very deep, very similar to Indian philosophy of the body healing itself. As you know, even physiotherapists believe in that.
Right.
And that is amazing how Americans had come up with that concept that Indians have been doing for a millennium. And they've put that in the chiro curriculum. So the founding of it was very philosophical. So just like when you look at a patient yourself, always the question is why, right? The question is why. So the why of why we do things is very important. So chiropractors are very, very sincere on that, the philosophical point of the body healing itself, that we are just assisting the body to be its optimal best. At the end of the day, we can have 100 patients with herniated discs. We treat them the exact same way. How come 40 of them are getting better, maybe 10 are getting worse, and the others are no change at all, right? And that is the intent of the adjustment or treatment. We are doing the best we can for the body, but the body at the end of the day has to adapt and heal on its own. And that's why it's very scientific, yet with a deep-rooted philosophy of why.
Right. Absolutely.
And just, you know, the founder of chiropractic, as you know, was, Dr. D.D. Palmer and Dr. B.J. Palmer. So this was developed by Canadians and Americans, 1895. We're talking about, many years ago.
Many years back, yeah.
Many years back, where the philosophy was, patients were not seeing an improvement with any medicine. They found that the very first adjustment was done by coincidence, where one of the staff or janitors in an office was having a hearing issue. So he looked and saw a big bump on his neck. And Dr. D.D. Palmer said, let me take a look. And he adjusted the neck, upper cervical spine. And the moment he did that, the hearing was restored. And that is how he first discovered that there's a connection between spine and nerves and physical attributes. So then he was able to develop that profession.
So you just mentioned about assessment. So in chiropractic assessment, what is it that it differs from the physiotherapeutic assessment? Like as far as physiotherapy assessment is concerned, we have on observation, then on palpation, then we move on to actual examination of different joints and muscles together. So how does physiotherapeutic assessment differ from the chiropractic assessment is what I think.
First of all, we do radiology, right? We may do an MRI, CT, and X-ray, which physiotherapists do not do in India. That's number one. Number two is based on that finding with our neurological exam. Again, I cannot speak for all physiotherapists, but most that I've worked with in India do not do a comprehensive neurological exam. So we do a full neuro. And again, it differs. You may do it there, and I'm not saying that, but many I've met have not. They more focus on muscle conditions and neuro-orthopedic tests, but not really a comprehensive neuro exam where you're checking all sensory, all outputs, reflexes, everything, and coordinating it with your radiology findings. So that is, I would say, the number one. And our reading of our radiology, if we have blood reports and all that, it becomes more comprehensive because we've had many conditions we've diagnosed that are not even spinal related. We are able to detect cancers, we're able to detect, especially in India, our doctors are quite trained to do all that. So based on that, then we work with the oncologist, we'll work with the orthopedic surgeon or the physiotherapist and co-manage the patient. So I would say maybe the radiology and the way we do our physical exam is a little bit more comprehensive.
In physiotherapy, we have different approaches like McKinsey, etc. Are there any the areas of movement analysis, particularly done by chiropractors?
Yeah.
uh,
So as I
specific
said,
movement analysis?
yes. So again, McKenzie and all that are just, a named treatment, that somebody in Australia had, and they're teaching that. That's not really, even physiotherapists in Canada do not go that way. They are, whatever's in the curriculum they're taught based on the curriculum. It's a little bit different. And then they're doing different movements based on seminars like you're doing in India. But for example, we have, if you had let's say a cervical problem or a lumbar problem, my education where I went to school, which is, in California, Life Chiropractic College West, we did 14 different techniques, right? We had one of the most techniques in the world. So I could assess and adjust your spine 14 different ways depending on what the issue is. So there's upper cervical techniques, there's called Nuka, there's called Gonstead, activator, Graston. I mean, there's many, many techniques.
So, sir, is there any different approach for pain relief that you follow, that chiropractors follow, which is different from physiotherapist's perspective? I mean, physiotherapist's view.
So that's a great question. And again, remember we were talking about philosophy, okay?
Yeah.
So if you have a patient that says I'm in a lot of pain, right?
Yes.
It doesn't necessarily mean we are doing anything about the pain. You cannot do anything, I cannot do anything. It is the body's response. So what we are doing is finding where the issue is, the abnormality, subluxation, nerve interference, whatever acronym you want to use. Wherever the issue is, we find and look at that spot. We are going to adjust that segment or treat that area based on our knowledge of what we are seeing. The response to that pain relief is what you're hoping to get, okay? But again, it's the body's adaptation to it, receiving the care and hopefully getting better. So when I compare that, physio, orthopedic surgeon, MBBS prescribing medications, all the same. Our pain management style or way we're treating is all the same, but again, the body's response different.
Are there any specific goals that you set for each and every session when you are doing any spinal adjustment?
Yes, absolutely. So we put them after our examination, we give them a diagnosis and a treatment plan based on science, literature, based on what we know today. We put it on a treatment plan. So for example, herniated discs, right? We all know the literature of herniated discs. Can they resolve on their own? Yes, maybe in 6 months to 8 months. If you're doing nothing, but if you're a laborer lifting heavy objects and you're repetitively doing the same thing, there's very limited that we can do, but we can still adjust the spine, treat the herniated disc, and you will find that, over the course of, let's say, 6 months to a year, they're either better than they were, or they're at least at the same area, they're not getting worse. And I'm telling you this based on laborers that we adjust in India that are doing very, very weight-bearing activities. So yes, we put them on a treatment plan, and it just varies and it depends on what the diagnosis is. So I mean, if you have a senior patient, or we have many cricket players, so professional, your IPL cricket players in India, Indian team are going to chiropractors. Okay, a lot of Bollywood stars that are action stars, stuntmen are coming to chiropractors. So for them, it's prevention, right? Prevention is better than the cure, as you know. So if they're in an activity that they know their muscles are being stretched, they're, or in a very active sport, or, their shoulder from bowling and cricket is hurting, that is what we're able to rehab and make sure we show them the right way to do things. So it's an active relationship between the patient and doctor to make sure they're not further damaging their body, or on their downtime, rest time, we're able to rehab it properly and make sure the joints, muscles, and ligaments, tissues, everything is working properly. So again, it just depends on the patient, just like in physiotherapy.
Okay. So, I just wanted to know, is there a stipulated time of recovery? It differs from patient to patient, but is there a stipulated time for recovery after doing spinal manipulations?
No. I mean, listen, as I said, there's many techniques. Some adjustments are 2 minutes, 30 seconds, a minute. Some treatments, if it's an extensive post-surgical rehab, are half an hour, 45 minutes. It just depends on what the treatment is. But there's no stipulated time because it just depends on the diagnosis. But as I said, patient outcome what are they feeling? Their subjective response is very positive, that they're feeling a difference pretty much after the first or second visit. I would say I rarely find somebody that says, I don't feel less pain or less stiffness, or I feel better. A lot of common thing is, I feel much better than when we started.
Okay. And pertaining to neurological conditions, what's your take on neurological conditions?
Well, as I said, we are all about neurology. One of the focus and foundations of chiropractic is neurology. So brain-body connection is huge. We're looking and learning all the neural pathways. As I said, concussions, okay? It's a big topic right now in North America, I'm sure all over the world.
Right.
All neurological, upper cervical issues that are impacting perhaps brainstem, or severe trauma, car accident cases where the brain is injured. So post-stroke rehab, right? All these type of conditions. So we have a very big focus on that. And again, depending on what is impacted, we're able to do that. Now, again, as you know, with physiotherapy too, with post-stroke, there's a lot of that.
Yes, sir. So I am a neurophysiotherapist, so I really am interested in post-stroke chiropractic. What you just mentioned. Is there any spinal manipulation or many patients after stroke suffer from painful shoulder or subluxation after suffering from stroke? So is there any adjustment done in those conditions?
Yes, that we are part of many post-stroke rehab. We're chiropractors are treating them. Absolutely. Okay. We are looking at what, again, assessment of the radiology reports and what the brain, the MRI will show, CT will show, where the damage is for the stroke rehab, right? If it's a TIA, right, obviously that's a different approach versus a full-out stroke. So that is where it comes in, and we work with physiotherapists closely with that on the muscle rehab. So we will adjust the, where we find the upper cervical issue or cervical issue, or even the shoulder joint or T-spine, because you'll find, depending on if it's a stroke, some of them have fallen, they've injured themselves on the fall, or if it is truly neurological, we're able to do certain techniques to at least try to restore some function. But we work very closely with the neurologist, neurosurgeon, chiropractor, and physiotherapist are on one team for that. So again, that's a deeper discussion. I don't think it's for this, but I mean, you and I can talk offline about how we can manage
absolutely. Healthcare is a huge community. It encompasses each and every healthcare worker, physiotherapists, occupational therapists, speech language pathologists, chiropractors. So there can be cases where there are conflicts of superiority happening. They contradict with one another or on particular patient or particular case. So what's your take on it? How do you manage when such conflicts may occur?
So first and foremost, I think we'll all agree, the welfare of the patient is most important. Right. And the problem always is our ego. We must shed our ego and work together. This is not about us. Whoever is the best person for that patient is what we should look at, right?
Yeah.
God has not put us in a position here for us to be having this ego and arguing with each other about who's better and who's more right and wrong. We work together. So my thing is always about collaboration. I have the utmost respect for physiotherapists. I think they're experts at what they do, fantastic at what they do. So I work very closely with physiotherapists. I respect them a lot. And I think the physiotherapists I work with, work very well and respect us a lot. And we work and collaborate and say, here's the information we have. Here's what you have. What do you think if we manage the patient this way, co-manage it this way? And I can tell you that, Dr. Janvi, that it is about relationships. So the first thing we need to do is with the surgeon, with the neurologist, whoever you're working with, is let's find the similarities first. Let's talk about what's common, okay? The moment we start criticizing or looking at something's better, we already have a problem, right? So I think try your best to work with people that are not going to be like that. And, perhaps if you're in a situation like that, I think talk to them privately or try to have a conversation, because if you there's a big energy component too, as you know. If you're in a room with somebody that's negative, you will be negative. Right. So try to be and try to give off positivity and love, and you will see healing happen anyway. I'm a strong believer of that what you give out is what you get, right? So it is a very good question. I've seen it a lot. but I've been very lucky and able to navigate it because I'm very confident in what I do, just like you are. So if you tell me, you or Dr. Ashi or you, Dr. Janvi, say, hey, I think my stroke rehab on this patient should do this. Unless there's something wrong, I have no reason to disagree with you. We can just enhance it with the chiropractic and work together to figure this out. Is that fair? I mean, that's all. I've been working like that for 20 years. I've never had a problem. And you have your collaborative team. They should be like-minded individuals that don't have this ego, where you can work together. In the public, if people are arguing about that, there's nothing we can do. I mean, that's fine. But you yourself with your patient should not be going through that. They should just be having the best possible outcome options. And listen, if you think that the other treatment is better, then humbly back off and let that person do their job, right? I cannot, if I know my physiotherapists look at recommending something for muscle rehab and they really strongly feel about it, they give me their diagnosis analysis of why would I argue that? And why would you argue with me if I give you my evaluation? If it's for the betterment of the patient, we work together. So I would say ignore the noise, try to ignore all that. You put out positive, collaborative newsletters like you're doing now, where you're talking to me as a physiotherapist. That is already showing that you're collaborating and working for positive outcomes.
Yes, sir. Yes, sir. So, how do we bridge these gaps? Any other measures that we need to undertake as healthcare workers to bridge these, create bridges between all professions so that there is a common goal? So, you being the founder of Indian Association of Chiropractic Doctors, what inspired you to start this initiative? And would you like to share any experiences regarding it?
Sure. When I was a student, remember I'm talking about many years ago now, when I came to India for a family wedding and realized chiropractic wasn't there, I was blown away. My relatives in India, my extended family were suffering, right? We're talking about they had no other option. Surgery, medicine, that's about it. There was nothing to do. So I was really drawn to that, to say, how can I help our country? How can I help our people be the healthiest possible? So when I came back in 2003, again, there was another family wedding and a friend wedding. And by that time, at that wedding, you may remember Sunil Dutt, who's Sanjay Dutt's father. Sunil Dutt was the sports minister of India at the time, and a friend of the family, and he was there, and we were talking, and he said, "Oh, you're a chiropractor." He goes, every country that our Indian cricket team goes to, they get to see the chiropractor from the other team, but we don't have it here. And he was very instrumental in giving us the energy and push to get forward and moving on it, because he knew there was a big push or plus to have chiropractic in India. Obviously, he was looking at the sports and Indian cricket thing, but he was the one that pushed. So I was able through, those relationships, as I said, it's all about relationships, to push forward. And since then, I've been coming back multiple times a year to give back to the country of India. So yes, we have clinics there. We also do charity. We do 3 Seva events every year, huge, where we bring 50 to 60 chiropractors from all over the world, non-Indian, from outside the world, India. They come to India, once in Delhi every year, once in Mumbai. And then we've added Amritsar Golden Temple, where we do just free service for the patients for 3-4 days, where we see 50,000 patients and just do free care. And it's fantastic. And since then, I think you alluded to it before our call. I was talking to Dr. Ashi that yes, I was the very first Indian, which I'm proud to say, that recently got elected as the vice president of the International Chiropractors Association. There's never been an Indian origin ever. So I was a very proud moment that first of all, first visible minority person of color happened to be, first Indian origin. And I'm also the chairman of the board for Life Chiropractic College West. And that is, one of the top chiropractic colleges in the world. And they have a huge focus right now on coming to India and growing chiropractic in India. So as I said, as I speak now, there is a group of doctors, chiropractors, physiotherapists that are opening one of the first chiropractic schools in India that's coming up. and that's one of a very senior physiotherapists in India that's part of it. And he recognizes that physiotherapy and chiropractic are very different. And he himself wants to get educated in chiropractic down the road and grow it in India. And he wants many physiotherapists to upgrade their credentials, maybe to be a chiropractor or MBBS or other doctors to get a specialty in chiropractic. Then we have another school coming up in Gujarat that is in the process right now. That is also by Life Chiropractic College West leading the way. And then the last is what I told you, that A-list Bollywood people are very excited because they're getting benefits. They're seeing chiropractors from America, UK that are seeing them on a regular basis when they travel, and they want to open a chiropractic school in India, and that's in the process right now. So very soon in the next year, you might see at least 1 to 3 chiropractic universities starting in India.
I really enjoyed this whole conversation wherein you really dived in deep, yet you were not diving in so deep to confuse the physios, because I feel every profession has so much more to it, and looking at it superficially, pointing fingers to someone is like very easy. But once you know what the actual thing is, once you know what chiropractic thing is, because to be really honest, I didn't know anything about it. I have seen many colleagues talking about it as something which they don't know. So the first conception of this idea came while creating this magazine's topics is I need to know what is chiropractic care. I need to know, because there are many people who just talk ill about any profession, and I have been someone to openly understand things, because if it's not there in India, which means it's something unventured, which means there is a lot of scope in India, and I have seen a lot of people practicing, physiotherapists doing it. Can physios practice chiropractic if they do a course? What are these certification courses?
No, because it's if I say tomorrow you can take a certification in physiotherapy, it's not possible. It's a 5-year education you did, right? You have to know anatomy, radiology, etc., etc. So for physiotherapists, what they do is whatever courses are similar, you can waive the courses and you do the difference of the courses in America, Canada, or in India. It will likely be that way. It's a degree. It's not a certification. It's a proper degree. So the orthopedic surgeon I told you that came from Delhi and went to New York, he did 2 years of chiropractic to become a doctor in chiropractic. So I'll give you an example. In India, just like you mentioned, there's many physiotherapists now that started doing the osteopathy certification.
Yes.
Okay.
Yeah.
So in North America, they ridiculed India because that is not osteopathy, what you're learning there. That is not even close. Somebody just decided to do a seminar and a certification. So nobody in the rest of the world for osteopathy will even accept that because it is not a certification. In America, osteopathy is like MBBS. They are learning pharmacology, they're learning surgery, they're learning, so you cannot just say, here's a weekend course. If tomorrow somebody came to India and said, I'm teaching you weekend physiotherapy courses, when you're done in 1 month, you will be a certified physiotherapist. I think a physio will never accept that, right? So the same respect is for all professions, that it is a big process. It is a full, if you do not know what you're doing, you can injure somebody, you can hurt somebody. So I say that with caution that the school that's going to open up will be a master's course, master's degree in chiropractic, and a doctor of chiropractic degree with accreditation. Your degree there will be accepted in America. Right now, the certification people are taking for osteopathy or whatever they're doing is not accepted anywhere. I don't believe even people are doing it properly or even efficiently there. There's about 5 or 6 people offering those courses, right? So we just have to respect the education, respect the process. So, I think you understand that, right? I don't have to explain it to you.
I totally respect that and I understand that. That's why I think we are here, because the amount of knowledge, the amount of information that is being blasted everywhere, getting a direction, getting things highlighted and scrutinized,
streamlined.
People fall into traps of getting into a wrong direction. Like some people just diss some profession, they don't understand the reality, and they just there's so much of mishaps happening in between these things. That's why we are here. I wanted to get so much clarity.
Dr. Ashi,
and yeah,
Dr. Ashi, what you're saying is perfect. So first and foremost, your physiotherapy education is perfect. You don't need anything more, okay? It is perfect to treat and rehab patients. Like, if you're questioning your education, then there's something wrong, right? By taking all these extra courses and certifications. Now, the extra certifications, just so you know, I know what they're about. We get to know about them. They are a money grab. It's just charging students, making money for nothing. It is not required or needed, and it's not correctly done. Half the time you don't need it. Now, if you're certain techniques such as, McKenzie, all that, if you're doing a proper, organized, structured course, that is fine. I'm okay. You can learn. But it is to enhance physiotherapy. You should never be doing something to say osteopathy is better than physiotherapy, right? Or chiropractic is better. It is your profession, which is wonderful. Be confident and proud of what you've done and what you are. Then you can learn other things, but there's no need to muddy the waters.
Yeah, like understanding that we should at least understand and respect other professions and actually divert. If I know that I am not able to, this case is something which should be handled by a chiropractor. I think that clarity, I still don't have. Like, which cases should be, suppose in India we still don't have that integration yet. So if I'm a practicing physiotherapist, how do I direct and I understand that this is something not under my domain? I think question unanswered.
I'll tell you. So I just told you spinal adjustment. Okay. So if you have a facet issue, degeneration issue, herniated disc issue, spinal stenosis issue, the way a physiotherapy treats it is a more muscle rehab, traction, things like that, right? Chiropractors are doing a specific adjustment to the joint, either above, below, at the area, and using physiotherapy rehab with in collaboration if they need to. Otherwise, we are finding any type of fixation or neuro dysfunction in the spinal column, and then we adjust it. That is, if we want to have one differing thing, we do a spinal adjustment with knowledge of everything you're doing. So right now, a physiotherapist what will they do on a facet issue or a disc issue? Maybe traction, maybe mobilization, right? Something like that.
Is chiropractic treatment like a faster way? It's something which, like, because getting the muscles in alignment, getting the muscles to do their work is something which takes time. It takes 6 weeks. Getting done with a chiro session in one session, getting results, that it's faster. So are you trying to say that chiropractic treatment is faster, but is it, like, I might be wrong, but is it something long lasting? That's my perception, and so how like that's a perception which I have. Like,
I will not say faster or slower. It's nothing about faster and slower. It's different. Let me ask you a question. Does muscle innervate the nerve, or nerve innervates the muscle?
The nerve innervates.
Nerve innervates the muscle.
And where does the nerve come from?
The nerve
the spinal cord to the brain.
Spinal cord, peripheral nerves. Yeah.
Okay. So based on that alone, our philosophy is different of why we're doing what we're doing. We are treating it from the root cause, the nerve, right? And then we're going into the muscle. When you have a physio muscle injury or muscle rehab injury, you'll find sometimes you'll have patients that it just doesn't get better for many, many, many times. You can treat for months and months. The reason is because we have a neurological imbalance, neurological problem that is innervating the muscle. So we come in, so it's not faster or slower, it's just different. Where if it's a muscle condition, I will refer to physiotherapy immediately and say, this is a physio matter. Nothing to do with the spinal column, subluxation, nerve irritation. That is more your scope, okay? And vice versa. If you have a facet issue, joint issue, degeneration, or you have nerve root entrapment, or you have, anything disc related, that is where you would likely send to us, because your treatment protocol is different. It is going to be mobilization, traction, TENS machines, modalities, whatever. And that is sometimes not the correct treatment. And it doesn't mean it's wrong. It just means it's different. It might be that even me, if I know there's something wrong, it's not getting better, and I think it's orthopedic surgeon is needed, I will refer to the orthopedic surgeon. Okay? That's why I'm saying when you do your diagnosis analysis, it all depends on what your diagnosis is. If it's out of your scope, you refer. It's very simple. And if you're finding that a patient is not getting better after X number of treatments of your treatment plan, I would look into the spine and look into the nerve and say maybe a chiropractor is needed. Okay? And same thing for me. I'm not going to waste the patient's money and time if they're not getting better, right? As I said, narrow-minded is everywhere. Even chiropractors will say about physio and all that, but I'm telling you that most chiropractors have physiotherapists working in their offices, or they work close by. We cross-refer. We have a very good friendly relationship here because we know what we're good at. I know what you're good at. But when I meet you and I adjust you and show you, then it will change your perception, because I think physiotherapists in India are confusing it with mobilization, confusing it with McKenzie, confusing with osteopathic manipulations. We are very different.